Thank you for having me today. And today's session is really going to focus on citizen science, an approach to engage the public and co-develop novel research questions. And if citizen science is a term that's unfamiliar, you're not quite sure what it is, hopefully by the end of today's session, you'll have a better sense of what it actually looks like. And as mentioned, my name is Codie Primeau. And my pronouns are he or him or il for those of you who are francophone. And I'll also talk a little bit about kind of what brings me into this space in the next few slides too. But before getting started, I would first like to share that today I'm joining from the traditional territories of the Anishinaabe, the Haudenosaunee, the Lenape and the Arawandran peoples. These lands are governed by the London Township and Sombra Treaties of 1796 and the Dish with One Spoon Wampum Covenant, an agreement to share and care for the land and waters collectively. And so this is a space that's colonially known as London, Ontario. So many of us today are joining from different locations across Turtle Island. Wherever we are situated, we're invited to reflect on our responsibilities to the lands we're on, the peoples who have cared for them, and who maintain connection with these lands over generations. This includes considering how our individual works can contribute to upholding Indigenous sovereignty, supporting self-determination, and holding ourselves accountable in respectful and meaningful ways. Here's an overview of what I'll be going over today. So first, I'm going to introduce the concept of citizen science. Second, I'll talk a little bit about the citizen science platform that team that I've worked with for the last 2 years, developed a few years back, and then discuss a little bit of a demonstration project that uses this citizen science platform to engage with 2S LGBTQI plus populations to co-develop research questions related to pain. So if this acronym is one that you haven't seen before, just for context, when we use this acronym, we're referring to individuals who are two-spirit, lesbian, gay, bisexual, trans, queer or questioning, intersex, asexual, and from additional sexually and gender expansive communities. Now, this is one acronym that can be used to describe the communities that I'll be talking about in this demonstration project. Not to say that, one is better than the other, but this is one of the more kind of inclusive ways that we can do it. And so this is just the terminology that I use in the work that I do. But throughout the presentation, I'll probably refer to these communities as queer and trans communities, just for ease of speaking through the talk. So I think it's really important before going into talking about the work that we're doing right now together, by giving a sense of where I come into the space. And so you've already heard a little bit about how we're working with queer and trans communities. I've already mentioned, my name is Codie Primeau. My pronouns are he or him, or il for those who are francophone, and I'm a queer and gay man. I'm also a cis man. I'm a settler. I'm white. I'm a francophone and able-bodied. And I recognize that my experiences through the intersections of those social identities are going to have an influence on my experiences and have on my experiences in navigating the world that we all live in, and how I navigate things like healthcare and chronic health conditions. I'm also someone with a history of chronic low back pain, something that's been part of my life since I was a child going into adolescence, and something that I continue to navigate. I also have two parents that are impacted by different forms of inflammatory arthritis, one with psoriatic arthritis and one with ankylosing spondylitis and fibromyalgia. And so hearing the background that Dr. Lee has shared of kind of the areas that I work in, it does bridge some of those worlds together from the lens of chronic pain, arthritis care, and my identities as a queer person. And I also come into the space as a researcher with 10 10 plus years of experience in spaces related to arthritis and pain. And I'm also a physiotherapist by training. And so I bring that clinical lens to the work as well. So again, I think it's always really important to come back to where we're coming into this space and our motivations and our backgrounds, because that definitely is going to set the tone for how the work moves forward too. So I'm sure we've seen a lot of discussions about patient and public involvement in health research, and we've seen an increasing amount of engagement in these approaches to the ways that we do health research. And we know from literature that actively engaging patients and public with lived experience can improve trust, it can better align studies with community needs, and can help improve outcomes. But we do have some limitations and challenges with current PPI practice. We often see that it's a similar demographic of people that are typically, quote unquote, invited to the table as patient partners, and the same individuals who tend to be participating as well. There's also some systemic barriers, things like stigma, mistrust, accessibility issues that can limit diverse populations from participating. And therefore, we see kind of that perpetuation of underrepresented groups often being either overlooked or being involved in more kind of tokenistic ways or in later stages of the work where their voices aren't necessarily able to help influence the direction and where that work goes. So, what is currently needed is finding some approaches where we can actually meaningfully collaborate with underrepresented communities in health research, where we have early and sustained involvement in shaping research priorities in a meaningful way. And making sure that we're going with our approaches more from beyond that place of inclusion into spaces related to actual equity. So if we go back a few years, the vision of the team that I've been working with is really to transform how people engage with research about the burden of chronic disease. And this is work that would really stem by actually Dr. Lee and a number of additional colleagues at University of British Columbia and with Arthritis Research Canada. And so the goal here was really to move in directions where we can actively engage people in the research process to understand chronic disease. And so in kind of discussions and how the group decided they wanted to move forward is really focusing on this idea of citizen science and where we work in a citizen science space. We're talking about citizen scientists, which are people with lived experience who are interested in contributing, learning about, and shaping science, and want to help or help share or collect information, which we as researchers call data. And in this case, when we say citizens, we're referring to essentially anyone on planet Earth or global citizens rather than tying it to citizenships from a nationality perspective. So I'll talk a little bit more about how that work moved forward in a minute, but first I want to give a little bit of a background on what citizen science is. And kind of looking at it in a more broad context, it's really focusing on that active public involvement in scientific research, not just as participants, but actual collaborators in that work. So it's an approach that originated in environmental science, where the focus is on community wildlife monitoring. I'm sure a lot of us have seen some of these in the past, where, for example, it could be looking at, what individuals are observing in the night sky in terms of constellations, or it could be, migration patterns of different birds. So there's a whole bunch of different projects that are out there, and that's really where this work stems from. But over the years, that popularity has really grown, and it's grown into a number of different areas. And we're starting to see this emerge in areas of healthcare and social sciences as well. Now, unlike traditional research design, citizen science does involve the public and more often than not in more than one stage. So multiple stages and in varying levels throughout the research, where they can be involved in different stages of planning to data collection to analysis all the way to dissemination, and more than one of these. And really, we're valuing the fact that lived experience and community expertise are essential to generate new knowledge. What I will highlight is that there's no real single definition of citizen science, and you can probably get that from how I just described it in the last slide, because interpretations and approaches can vary based on field and context. And for a while, it became really challenging for individuals to get a sense of, well, citizen science, like what do we mean by that? What is it? And so the European Citizen Science Association established 10 core principles that were developed as guiding effective and ethical citizen science projects. And really, these principles are aiming to emphasize transparency, inclusivity, shared power, and mutual benefit. So, if we think back to what I was talking about in some of those earlier slides, where we're lacking that engagement from particularly underrepresented communities, these different principles are key ones that are needed for engaging communities who are often left out of research. And in these types of approaches, really what we're focusing on is democratizing knowledge production, where we're breaking down some of those traditional researcher and public divides or some of those power dynamics that may exist, or minimizing them at least. And it's offering a powerful way to engage underrepresented communities and co-create research that truly reflects diverse needs and experiences. And so this is just kind of a visual representation of what those 10 principles look like. This is just a schematic that I created based off of what has already been shared for a number of years now. But these 10 principles focus on active public involvement, genuine science outcomes, so making sure that these projects lead to meaningful scientific results, that there's an actual mutual benefit that's benefiting both those who are participating as citizen scientists and the scientists or researchers who are working in collaboration, that there are multiple points for engagement. So it's not kind of a one-off opportunity to participate in the research process, that there's multi-stage possibilities, that there are feedback mechanisms so that citizen scientists are able to receive feedback from the project. And I'll show some examples of how that fits into the work that we're doing together as we go through the presentation. That we consider the research approach that is limiting limitations and biases, and that we're also providing opportunities for open access so that the information is accessible to everyone, not just individuals who are able to access, an academic publication, for example, in a journal that's not open access. Making sure that there's opportunities for acknowledgement, so recognizing contributions of citizen scientists in results and publications and presentations. And then two other pieces more related to, quality and impact and legal and ethical considerations with respect to engaging with a large number of individuals, potentially on, a national or international scale. So these are some of those guiding principles that you can really take and fit to the type of work that you're trying to move forward. Because what works for one area isn't necessarily going to work for another area, and what works for one community isn't necessarily going to work for another community. So these are just kind of overarching principles. And so if we think of the project that the team at University of British Columbia and Arthritis Research Canada had developed, it's really in the essence of the citizen science approach. And it all started with wanting to have a better understanding of the burden of chronic health disease. And so the team, when there were some of those earlier meetings, decided in 2018 that the focus would be on the burden of pain. And so the team worked collectively together, bringing in partners, individuals with lived experience as patient partners, researchers, clinicians, digital media experts, and together co-developed and user tested some prototypes in the year of 2019. And so through that process, working collaboratively as a group came to develop the citizen science platform that has been live since 2020. And since then, individuals have been able to access this online platform and engage in ways that are most meaningful to them. That has been, or since then, they've added on some data visualizations in 2021, where individuals are also able to see with what they've shared, how other individuals are responding to some of those questions on the online platform, so that they can, compare and kind of see how their experiences fit within the context of how other people are sharing as well. And then in 2022, the group also expanded on this online platform that focused on the burden of pain to include a section that focuses on the burden of long COVID in collaboration with the post-COVID-19 Interdisciplinary Clinical Care Network. And so that is live since 2022, and individuals are able to access either of these now. So I've highlighted a little bit already that in development of both the burden of pain and long COVID portions of this online citizen science platform has involved, to a great extent, a number of patient partners who were part of the process through all steps of developing the platform. And so this included three patient partners for the burden of pain and six for the long COVID portion. So thank you again to these individuals who continue to be a part of this work. So, just kind of giving a high overview, the citizen science platform is a place to answer, share, and compare. Um, Related to a number of different aspects that influence an individual's day to day with respect to the pain they experience or their long COVID experience. So these could be questions related to demographics, current needs, medical conditions, and then also things like personal stories about lived experiences with either pain or long COVID. And so this is just giving an overview of what it looks like. Individuals are able to access this online portal. It explains what a citizen scientist is. You're able to access either the pain or the long COVID surveys from this platform. And so what we see is we're going down now to where individuals are able to explore some of those data visualizations I was talking about. So this is an example with long COVID, where you can see symptoms that people may be experiencing, and then you're able to put some specific criteria to see, based off of particular demographics, how do those results look. So you can tailor it a little bit more to your own experiences and see what other individuals are sharing in the form of these data visualizations as well. Now, do want to highlight that the online citizen science platform is published on the Government of Canada website in their citizen science portal. So really showing that, again, it's an environmental science background in terms of the approach and its roots, but we're starting to see the emergence of health uses for it as well. So now I'm going to talk a little bit more specifically about a demonstration project that is leveraging some of those citizen science concepts and leveraging the online citizen science platform that I just talked about. So to give a little bit of a background first, we know that chronic pain is one of the leading causes of disability and reduced quality of life worldwide. And in more recent publications, it's been shown that queer and trans communities experience a greater prevalence of pain. We also see a more widespread distribution of pain experiences and a greater impact on day-to-day activities for queer and trans folks. But I will say that this data is primarily driven by administrative data, and we need to recognize as well that this depends on who is contributing to those data. And I highlight this because often accessing safe and affirming healthcare is challenging for queer and trans individuals. A number of reasons why. Sometimes it's related to negative healthcare experiences, including direct experiences with their healthcare provider. This ultimately leads to large unmet healthcare needs and leading some to delay or avoid seeking care altogether. But it's really important to recognize that, neglecting the unique experiences of queer and trans communities may lead to suboptimal care, and even unintentional harms. in some ways. And so we know that in chronic pain research, decisions are being made to set research priorities, and some have already been set depending on the organization. And this is often now with the involvement of patient and public partners. But we know that historically research is centered on the experiences of cisgender and heterosexual individuals, and excludes the voices of queer and trans persons, and therefore their voices are not necessarily reflected in those priorities directly anyway. So it's really unclear if current research questions align with the concerns of queer and trans individuals with pain. And it makes, myself and a number of the people I work with wonder, are we asking the right questions? And so to get a better sense of how we can move forward in this space, that brought on the question of how can we engage with queer and trans communities while contributing meaningfully, both to community development as a whole, but also in research, and to address the most pressing questions while fostering trust and building relationships. And so our objective with this project is really to maximize queer and trans community involvement in guiding the co-development of novel research questions about living with pain. So if we think of the traditional research design, often we have identification of a research problem, review of literature, which is followed by setting research questions and hypotheses, and then we design a study and collect data. Now, I will say that typically those research questions and hypotheses are set by either clinicians or researchers or in combination, where community input usually happens after those questions have already been set. But if we think specifically about, what research questions are meaningful to queer and trans individuals related to living with chronic pain, we do know that there's a research problem. So there's greater pain that's experienced by queer and trans individuals, and at multiple layers, not just prevalence but prevalence as well as the degree to how it impacts individuals. But the literature still is very sparse, and there's actually a lack of input on lived experience from queer and trans individuals. And really, right now, we don't have any specific set research priorities. So this got us thinking, well, how can we reorganize the methodology a little bit where rather than having that community input happening after those questions have been set, bringing it before the actual identification of research problems? And so, if we reorganize that a little bit, focusing more on nationwide public input related to pain earlier on in that process, where then we can identify more specific research problems and then work collaboratively with individuals to co-analyze information, co-develop questions, co-prioritize questions, and then co-design studies together, where we actually get community input happening at all stages of the process. And by community, this could be individuals with lived experience of chronic pain. It could be caregivers. It could be researchers, clinicians, digital media partners, depending on what makes most sense for your team. And so this is where Shape Plus was born. So Shape Plus is a study that's looking at shaping research in pain through equity for queer and trans communities. And so if you're interested on learning more about it, there's a QR code that goes directly to the website for our project that's ongoing. So to talk a little bit more about that project, first I'd like to give context on who's part of our team. And our team is primarily led by an advisory committee who jointly is deciding on all project-related matters. And this is anywhere from recruitment all the way to conflict resolution, actual data analysis, knowledge translation. So all stages of the process for the project. And it consists of 6 queer and trans members. These are individuals with lived experience, clinicians, researchers, and we're working together to really help move this work forward. And within this group, it includes unique, diverse lived experience and perspectives within the team to really complement one another's areas of expertise to help move this work in a direction that allows us to engage with community to a larger extent. And so we have a community partner as well, the Community-Based Research Center, which is a national organization that focuses on community-based research with queer and trans communities. And so we are working very closely with them as well. So, some of the key considerations related to this work that we needed to think about in developing the project, we need to make sure that we have capacities to capture diversity of perspectives. So, there are various queer and trans identities and intersecting identities beyond just social locations related to sexuality and gender. So, making sure that we do capture that diversity. We also wanted to make sure we're accounting for geographical flexibility, so getting nationwide perspectives that includes rural and remote communities, and really prioritizing engagement with remote communities that typically are not able to participate in research in some ways, and time flexibility. So recognizing that pain is something that has fluctuations, having the ability to participate whenever and wherever is most convenient for the individual is really important. Also, having opportunities for multiple engagement, recognizing that symptoms related to chronic pain are can be episodic in nature. And also having opportunity for anonymous engagement, recognizing that queer and trans identity isn't necessarily something that is safe for all individuals to share publicly, given where things are in a social context around the world right now. So having opportunity to engage anonymously is very important. So, the project that we have co-created together is really focused on three steps. The first is actually leveraging the online citizen science platform, where we can gather queer and trans public input via this platform. So, coming back to some of those earlier slides, that platform is a place to answer, share, and compare. And for the comparison piece, we see an example in the bottom right corner of a data visualization. And through this platform, individuals are able to share information about, their demographics, their current health needs, quality of life, their symptoms, and then some personal stories about their lived experiences as well. And really, in those earlier phases, we're focusing on trying to engage with a large number of queer and trans individuals via this platform. And so on the right, you can see some of the recruitment material that our team has developed. And we have this public engagement plan that was developed with the advisory committee that is set in multiple phases to maximize that engagement. We also have some prioritization in the ways that we're engaging. So making sure that we're focusing on how we can engage with, for example, Indigenous communities, individuals from trans and non-binary communities, and individuals who are living in rural communities, among additional groups of individuals, again, who are historically not well represented in the research process. And this involves both in-person and online engagement. And we're working again with some of our networks and community partners for this. Now, this is an ongoing process. So the project is launched. We have individuals who are engaging with this platform. And our next plan of action is really discussing how we're going to analyze those data. So that's being decided upon with the advisory committee, where we're looking at both quantitative pieces related to demographics, patient-reported outcomes, and social determinants of health. And then we have those open text responses as well, where people have shared their personal theories about what causes their pain and its impact on their daily life, as well as personal stories of living with pain. Once we're able to analyze and look at some of that data, the second step is really to focus on the co-development of pain research questions through group discussion workshops. And for this, we're bringing together a working group of queer and trans patients, clinicians, and researchers with diverse lived experiences from across the country. So this is a group that's separate from our advisory committee. And what we will be doing is using the citizen science information to facilitate discussions in the working group. And then over a period of 2 days in those discussions, ultimately co-developing research questions related to pain. So this will be facilitated both through a summary of how those data are analyzed, as well as more of an interactive way of using some of those data visualizations that we have online to be able to gather some of that information in real time too. Ultimately, what's going to be happening is that we're going to analyze the discussion data through a process of group concept mapping, which will ultimately allow us to create map clusters of questions and allow us to guide planning of future work. So we can see on the right-hand side here, these essentially dots are representing questions that may come from those group discussions. And then going through the process of group concept mapping ultimately leads to these different potentially pillars of areas of work that could also set the foundation for new areas of research to explore in the future with those individual questions that are associated with each. So here's an example of how we may develop a research question based on the data that is provided. So let's say we're exploring the association of multiple variables with pain severity in individuals from queer and trans communities. And then we come to find that fewer health consultations over the last 12 months is associated with greater pain severity. So through these group discussions, having a better understanding of, well, why may that be, or what may be some things we want to explore. A potential research question that may come up is reduced healthcare utilization related to previous negative experiences with healthcare. And then we can actually go a little bit further than that and ask, what strategies can be used to improve access to care for queer and trans individuals. We also want to be thinking about additional lenses. So, does the relationship vary among different queer and trans identities? So we may see that, for example, that relationship is there for individuals from, lesbian community, but it's not necessarily there for gay community, just as an example. So wanting to explore that, and then there may be some question prompts that come from those discussions. Example two, working more with some of the open text responses, we may see in developing some of those themes that theme can come out that there are challenges in managing symptoms due to drug interactions between gender affirming treatments, hormone therapies, for example, and some of the medications that individuals may be taking to manage their symptoms. So then a question that may prompt from that could be, what alternative strategies can we use to help individuals manage symptoms in a gender affirming way? So those are just a few examples. Again, we're not at that stage yet, but that's kind of what the process will look like. And so the last step, step three, is really focusing on co-prioritizing the questions through nationwide input, where we'll be using a Delphi process, where we'll actually share those co-developed research questions with that group of community members back with the public who originally engaged with the online platform to get consensus on question priorities. So in this process, public can rate the questions based on the usefulness and importance over a repeated series of rounds. And then between rounds, our advisory committee will meet to discuss those results and refine the questions. And then ultimately, those results will be combined to summarize a final priority ranking for future work. Again, laying the foundation for future research programs. So in summary, to just kind of tie it all in together, again, that step number one is gathering the nationwide public input from queer and trans communities via the online citizen science platform. Through this, participants can also compare their responses with others. So there's that real-time feedback with data visualizations generated from the platform. And then those data visualizations and the public insights that have been analyzed by the advisory committee will both ultimately inform group discussions, where in step two, we'll be developing research questions in group discussion workshops through group concept mapping. That will be led by a working group of queer and trans individuals who will be the ones deciding on those questions. And then those questions will actually go back out to the public for co-prioritization of the questions through nationwide public input, where, yeah, we have that opportunity for re-engagement. And ultimately, we have an advisory committee of queer and trans individuals engaged throughout the whole program. So again, if we revisit the ECSA's 10 principles for citizen science, we can see that each of these are emerging in the ways that we've approached how we've designed this study. So we have, that active public involvement. We have it at multiple stages of touching that fourth point. There's mutual benefit. We're working collaboratively with community. There are outputs that are going directly to community, and I didn't get a chance to talk about all of those today, but just to give us a general sense, ultimately leads to genuine scientific outcomes. Making this information publicly accessible through open access. There's opportunities for feedback mechanisms with those data visualizations. So um, just to show that, it's really rooted in those 10 principles of citizen science. And really, what this work will help us understand is, we know that queer and trans individuals experience increased prevalence and the degree of impact with pain. But really, I see that as the tip of the iceberg. And there's really so much that we don't understand below, and some of those factors that have an influence on pain. And that intersection with queer and trans experience, ultimately making sure that we're developing a research program and questions that are focused on what community needs, both from a positive and negative experience, because we often see this negative framing of queer and trans experiences with pain, but there's also a lot of positive that comes from some of the discussions and experiences I've had talking through experiences with pain with friends, colleagues, that, hoping to highlight more of those positive experiences as well through this work. So, coming back to the overall idea of citizen science and the value it has for community members and how it kind of ties into this project specifically too, we have greater active involvement in the research process, including decision making. So, different levels for that here. We have the advisory committee, we have multiple points for engagement for participants. And there's also greater opportunities for sharing knowledge in that context. So the incorporation of data visualizations help with that knowledge mobilization piece too. Individuals can participate more than once, so we're able to track episodic nature of symptoms through multiple points of engagement. And ultimately, future research questions guiding policy are going to be informed directly from the lived experience of queer and trans public. There's also a lot of values for researchers. So today I talked about one demonstration project that's leveraging this online citizen science platform. This is the first demonstration project that's using the platform. The key here is that these data ultimately are available to all researchers who are interested in developing research questions related to pain. So we have this constant ongoing building of shared information with rich insights of lived experience. So, if we look at the left-hand side here. As we have more and more engagement, there's greater public input on experiences with pain. And we see the same thing with the long COVID portion of that online platform. So we're always seeking collaboration from researchers who are interested in using this data to drive input to the online platform too. So ultimately, how can this approach add value to understanding pain? Well, our approach prioritizes building relationships and trust with queer and trans communities, knowledge sharing with the community, and engaging underrepresented individuals who are typically excluded and do not have opportunity to participate in research. Ultimately, this work is being done by and for queer and trans communities, and by centering the work around queer and trans engagement, we're developing research questions that better meet our community needs. And so I would love to take some time to thank everyone who's involved in this work, a large number of people in different stages and extents of this work. So people from our advisory committee, the patient partners who help build the online platform, and the investigators and digital media partners who are ongoing and actively involved in this work as well as the organizations who have funded this work. So, really would like to kind of bring things back again to the Shape Plus project that, again, has been launched, is ongoing. So, if you're able to help spread the word so that we can increase the amount of engagement to this online platform, please feel free to take a look at the QR link here and encourage people to visit patientscientist.ca. There's also, again, the burden of long COVID portion of the online platform that you're able to access at this QR code too. And here is my contact information, the contact information for the Shape Plus study, and for the online citizen science platform if you're interested in engaging further. And with that, thank you so much and happy to take any questions that people have.
Thank you so much, Cody. It's wonderful presentation, and every time I hear you talk about this topic, the more I sort of appreciated the process that this time you spend on building communities and building relationships, and as well as trying to advance the science around citizen science and the practice of it. So the floor is open for questions and comments, and I'll invite anyone who has a question for Dr. Primo. Please either use the chat function to ask the question, or if you would like to ask yourself, please use the raise hand function, unmute yourself, and we'll hear you there. Now, while we're waiting for questions to come in, Cody, maybe I can ask you one right here. And you and I talk a little bit about the how to handle power dynamics in working with people with lived experiences in a research setting. So I'm wondering if you can talk a little bit about how do you handle power dynamics when involving community members in the research design and in the data collection in a citizen science project.
Yeah, that's a really important question. And for one, I will say I think that the handling of power dynamic is really dependent on the group that you have too. There are definitely strategies and kind of a larger context that you can use to try and address power dynamics. But yeah, it ultimately will be driven by the people that you're working with too, and what the individual needs are of the people who are part of that group. So some of it is can be guided by having those initial conversations of what people's expectations are for being part of this work, and making sure that we're all on the same page with it. Individuals may want to be entering that space with a more heavy involvement. Some individuals may not necessarily have that same capacity, but making sure that we have that kind of open communication, and that's kind of something that comes back in all points of this is really the communication piece, right? Having that open, ongoing, continuous communication, but making sure that that base of what the expectations are from everyone who's part of the group really sets the tone to get things started. Uh, Inherently, the way that research is designed, there's always going to be a little bit of a power dynamic there, between patient partners, community partners, and researchers, but trying to minimize that as much as possible. So, in which ways can we do that? Some of it may be related to the way that we run our meetings. Is it that we have when we always have the researcher that's leading that meeting, that may not necessarily that may further perpetuate that power dynamic. Whereas if, depending on the meeting topic, we have different people who are part of that group, whether it's a community partner, whether it's a researcher, whether it's a clinician leading those discussions and leading those areas of work, then, we have equal opportunity or more equal opportunity for people to have some of those leadership roles within the team. So this is speaking a little bit more directly about the advisory committee. So that's just kind of one example, but really thinking about what will work best for your team. And then thinking about, what are some of the challenges that may come into play, and then working through that. We actually just published a paper focused on that topic that was published in BMC Research and Involvement. I forget the exact title for it. So there's a lot more. There's actually a table in that paper that talks about it. I can actually drop the link to that paper for those who are interested. If you give me a second to take a look at it and find it. But yeah, there's a list of things that you can be thinking about in terms of addressing that power dynamic in research environments.
Yeah, no, that's great. Thank you, Cody. And I think we can also find that as well. 'Cause, I think there's another really great question
Yeah.
that just came in from Linda Willem.
Mhm.
So Cody, great presentation. Do you know of any citizen science dialogues with people living with disabilities?
Can you perhaps clarify a little bit more about what you mean by dialogues, Linda?
Okay. Hi, Cody. How are
Hi,
you?
it's great to see you.
Just yeah, I can only imagine as a person who lives with the disabilities and the challenges that I face trying to get my voice heard. I would imagine it's 10 times worse for the LGBTQ community if they're living with a disability on top of all the other issues that they face accessing care and getting heard. So I'm just curious if you've heard of any. I know it's not maybe your area of expertise, but it is an area I think that we need to look at and figure out how to engage with people with disabilities to get their voices heard better.
Yeah, absolutely. And in this particular project, our focus is we want to make sure that it's impossible to reach everyone, but how can we really make sure that we're putting all the efforts forward that we can to connect with, again, those individuals who typically aren't able to participate in research. So,
Yeah.
um, things that we haven't had a chance to talk about yet because we're still in those earlier phases of engagement, but some things that I've been thinking about are, let's say someone may not necessarily be able to navigate online citizen science platform because of some kind of cognitive challenges with navigating a website. So, are there ways that we can still engage with those individuals to, have their voices included in the process of how we're navigating moving this work forward? But it may not necessarily be coming from the exact same source, right? Because that's just not feasible for that person to be able to engage in that way. So yeah, again, coming back to some of those principles and multiple opportunities for engagement, not necessarily staying strict to one way, but also adapting to the community's needs. I'm talking broadly about queer and trans communities, but you've highlighted that, within queer and trans communities too, there's different needs depending on what people's individual experiences are too, right? So, that those are some of the things that we're continuing to think through and navigate in ways that we can do it, um, recognizing that it may take a lot of time and it also may take a lot of funds to be able to do it in the perfect way we would like to do it, but how can we kind of meet halfway?
Yeah, and I know like for me, there's webinars where I participated where they only allow you to put in the chat. You can't really ask a question. You can, well, my hands, it's really brutal for me to type in a chat. I mean, I do it. Obviously, I did it today, but it's a way that's difficult for me to participate. So I think it's something we have to really think about. So
Absolutely. Yeah. And thank you so much for raising that very, very important point too.
thank
Yeah. Thanks, Linda.
Thank you, Linda. Great questions. There's another great question from Carrie Delaney.
Mhm.
Hey, Cody, thanks for your talk. Could you talk about the challenges to obtaining funding for this type of work and how you have, overcome them?
Yeah, I will admit, getting funding for this type of work is definitely challenging. There are some costs considerations with respect to maintaining the online platform, for example, so that we have the funds to keep it going. So that is in collaboration with partnerships that we have with some organizations who also believe in this work, which is important to have. But for this project specifically, the Shape Plus study, it does kind of have to start from the smaller pots of funding, because it is in terms of the approach that's being used and essentially developing research priorities. when there's not a direct link to those scientific outcomes that some funding agencies are maybe looking for, it does become a challenge. But starting with some of those smaller pots of funding and working with what's available has so far worked for us. Planning and dissemination grants or smaller pots of money that are available through specific organizations related to different chronic health conditions. If it's a $10,000 here, $20,000 here, and pooling that together has been the way that has worked for us. And ultimately in the future, hoping for that to expand a little bit more, but wanting to get the ball rolling with this project a little bit, I think we need to generate more output so that we can show the actual progress of it and the impact it is having. And I'm hoping that by then that will allow us to leverage a little bit more larger pots of funding for bigger projects. But because it is an approach that, again, historically has been used in environmental science context and is starting to be applied in more health research type contexts, I think that there needs to be some groundwork laid first before we can start applying for those larger pots of money for it.
Yeah, no, that's totally appreciate the challenge, and I think one of your funding sources through the Arthritis Health Professions Association, if I remember correctly. So that's what the sort of the $10,000 that you are talking about, and I think like those sort of smaller amount like smaller grants are really really important to help in terms of building relationships and get this work started. So, thank you so much for your effort in leading this work. Um, so looking at the questions here, and while people may be thinking, a few more that they would like to ask in their mind, and let me just slip in one more that I'm really curious about. So you talk about the intersectionality of, individuals that you'd like to engage. I'm wondering you can talk a little bit more about how do you successfully reach and engage individuals or communities who are, often left out of the traditional health research. Again, especially those who may not already be connected to advocacy groups or healthcare systems.
Yeah, a very challenging question, but a very, very important question. And for us, the way that we're currently approaching it is really prioritizing our efforts for engagement with those communities who typically have not had an opportunity to participate. And by really focusing on those communities, I mean, there will be opportunity to engage with the individuals who historically are able to participate, right? Like we can share widely, people will see that this information is being shared, and we can still have some more that kind of passive engagement with the online platform. But really focusing our efforts on engaging directly with some of those communities. And part of the inclusion of people in our advisory committee is based on the relationships that exist already with some of those smaller communities. When we're talking about remote communities, for example, or working more specifically with Indigenous communities and the intersection with those, and working more specifically with trans communities, the people who are either part of our advisory committee or direct collaborators of individuals who are part of our advisory committee. And those kind of focused efforts on engagement are really key, right? Prioritizing that engagement with those individuals. Starting with the relationships that we either directly have or indirectly via another person. But that is an ongoing, continuous building process where hopefully if we have more funds that are available, we have greater, human resources to be able to actively go and engage with some of these communities a little bit more directly. So that may be the next steps of this work, where, we can't reach everyone, but what are the efforts that we're putting forward in engaging directly with those people who typically are not included in the discussion?
Yeah, no, that's like I guess the key takeaway is that relationship building and trying to reach communities that are, have not been, like traditionally, well engaged in, developing research processes, or it is a continuing process. So, the efforts that you put in is certainly is important, and it takes time to do that. So thank
Absolutely.
you for that. I'm trying to see if there's any additional questions coming in the chat, or anyone who would like to ask the questions. Please unmute yourself. And while we have Codie here.
Sure, I'll ask a question. Really interesting presentation. So it's to build on your last question, Codie. How will you navigate the bringing in partners who typically aren't part of research that might challenge within the dynamics of the different groups? Just thinking about the ongoing rhetoric within 2S LGBTQ communities, like for bisexual, lesbian, and gay, versus folks who might be trans or queer, and how there's those frictions within the community. Just think about some of those pieces are having rural or 2S, Two-Spirit folks in their lived experiences versus like an urban queer or trans person. Just like, what are your thoughts on some of those dynamics?
100%. Really, really important point. And that, so that we're having discussions right now as the advisory committee on how to navigate it, exactly that piece of it. And some of it is actually we may need to split up the discussions where we can have opportunities that are a little bit more focused on, let's say, bringing individuals from Two-Spirit, Indigiqueer communities that are having discussions that are a little bit more focused on individuals' experiences within, the Indigenous lens. So, we have individuals who are part of our advisory committee who are from Indigenous communities as well. So that's kind of one example. It may be more focused discussions that talk about the experiences of trans folks, where it's only trans folks who have lived experience that are part of those discussions as well. And so, yeah, really focusing on how we can get rid of some of those power dynamics and essentially the silencing of those underrepresented voices that we see in research and in society as a whole. How can we address it and break it down? So some of it is having more focused discussions. I know we're kind of getting close on time here. Happy to chat about it on a different time. You can also send me an email, Blake. But yeah, I love talking about that piece of it. Um, I know I didn't get a chance to elaborate a whole lot, but yeah.
That's great.
Yeah.
Thank you so much for the great questions, and thank you, Codie, Dr. Primo, for spending time with us. That draws the session to a close. And before everybody leaves, please click the link for the evaluation. We'd love to hear from you for about today's talk. And with that, I thank you everyone for your participation, and you're free to disconnect. Thank you.
Thank you. Thank you,
Everyone.
Codie. Thank you, Linda. Thank you both so much. I'll follow up with you, Codie, with a couple housekeeping things, but yeah, I'll talk to you soon.
Sounds great.
Thank
Thank you.
you.
Thank you.